Hashimoto's disease is an autoimmune disorder where the immune system attacks the thyroid gland, leading to hypothyroidism. Symptoms can include fatigue, weight gain, cold intolerance, and depression. Diagnosis typically involves blood tests measuring thyroid hormone levels and antibodies. Treatment usually consists of thyroid hormone replacement therapy to manage symptoms and restore hormone balance. It's essential to work with a healthcare provider for effective management. What is Hashimoto's disease? Hashimoto's disease is an autoimmune disorder. This means the body's immune system mistakenly attacks its own tissues. In this case, the immune system targets the thyroid gland, a small butterfly-shaped gland located in the front of the neck. The thyroid produces hormones that regulate many important body functions such as metabolism, body temperature, heart rate, energy levels. Over time, the immune system gradually damages the thyroid gland, which can lead to reduced production of thyroid hormones. When thyroid hormone levels drop, the body's metabolism slows down. Who is most likely to develop Hashimoto's disease? Hashimoto's disease can affect anyone, but certain groups are more commonly affected. It occurs more often in women than men, especially between the ages of 30 and 60. People may also have a higher risk if they have a family history of thyroid disease, have other autoimmune conditions, have had radiation exposure to the neck, or have certain genetic factors. Autoimmune conditions sometimes occur together, so people with disorders such as type 1 diabetes, rheumatoid arthritis, or lupus may also be at increased risk. What are the symptoms of Hashimoto's disease? Symptoms can develop slowly over months or even years, which sometimes makes the condition difficult to recognize early. Common symptoms include fatigue or constant tiredness, weight gain without major dietary changes, sensitivity to cold, dry skin, hair thinning or hair loss, constipation, muscle weakness, slow heart rate. Some people also experience depression or low mood, memory problems or brain fog, puffy face, hoarseness of voice. Women may also notice changes in menstrual cycles or fertility issues. Not everyone experiences all of these symptoms, and sometimes symptoms can be very mild at first. Can Hashimoto's cause swelling in the neck? Yes, it can. Some people develop a goiter, which is an enlargement of the thyroid gland. This may appear as a swelling at the base of the neck. A goiter is usually painless but may cause a feeling of tightness in the throat or mild difficulty swallowing in some cases. How is Hashimoto's disease diagnosed? Doctors usually diagnose Hashimoto's using blood tests. The most common tests include 1. TSH test, thyroid stimulating hormone. 2. Free T4 test, measures thyroid hormone levels. 3. Thyroid antibody tests. In Hashimoto's disease, doctors often find elevated thyroid antibodies, especially TPO antibodies, which indicate the immune system is attacking the thyroid. Sometimes doctors may also perform a thyroid ultrasound to look at the structure of the thyroid gland. Is Hashimoto's disease curable? Currently, Hashimoto's disease cannot be cured, but it can be very well managed. Treatment usually focuses on replacing the thyroid hormone that the body is no longer producing adequately. The most common treatment is a medication called levothyroxine, which is a synthetic version of the thyroid hormone. This medication helps restore normal hormone levels and improve symptoms. With proper treatment and monitoring, most people with Hashimoto's live normal and healthy lives. Can lifestyle changes help manage symptoms? Yes, lifestyle habits can support overall health, although they do not replace medical treatment. Helpful lifestyle practices may include maintaining a balanced diet, getting regular exercise, managing stress levels, getting adequate sleep. Some people also work with their doctor to monitor iodine intake, vitamin D levels, and selenium, which can influence thyroid health. However, it's important to discuss supplements with a healthcare provider before starting them. Can Hashimoto's disease affect mental health? Yes, it can. Because thyroid hormones influence brain function, low thyroid levels may contribute to symptoms such as depression, anxiety, difficulty concentrating, memory problems. When thyroid hormone levels are corrected through treatment, many people notice improvement in these symptoms. Can Hashimoto's disease cause weight gain? Weight gain is a common concern. When thyroid hormone levels are low, metabolism slows down, which can contribute to modest weight gain. However, treatment with thyroid hormone replacement usually helps stabilize metabolism. Healthy diet and physical activity also play an important role in maintaining weight balance. When should someone see a doctor? It's a good idea to consult a healthcare provider if you experience persistent symptoms such as unexplained fatigue, sensitivity to cold, hair thinning, unexplained weight changes, neck swelling, or ongoing mood changes. Early evaluation and diagnosis allow doctors to begin treatment sooner and prevent complications. In summary, Hashimoto's disease is a common autoimmune condition that affects thyroid function. Although it develops gradually, it is highly manageable with proper medical care. If you suspect thyroid symptoms or have a family history of thyroid disease, speaking with a healthcare provider and getting simple blood tests can provide helpful answers. With accurate diagnosis and proper treatment, most individuals with Hashimoto's can maintain excellent quality of life. Thank you for listening, and I hope this overview helped you better understand Hashimoto's disease. If you like this video, please subscribe to Doctor's Advice channel for more healthcare updates. If you have any health concerns, please comment below. See you next time.